Do you know how your breast or nipple appears, looks, or feels like? Without knowing this, it can be difficult identifying changes in your breast. So, spend few minutes with me as we throw some light on some changes that can happen to your breast or nipple, as well as how often you need to examine your breast, including the 3 major ways how self-breast examination can be done. One of the core aims of breast cancer awareness is to encourage screening for breast cancer, especially for women. Breast screening aid in detecting breast cancer at a very early stage before a person has any symptoms. And since everybody has different consistencies and feel of their breasts, being aware of how your normal breast feels enable you to detect any abnormality at the earliest. And through regular self-breast exam, you can physically and visually examine the breast in your home for signs and symptoms of breast cancer. It is very important to be aware of how your breast and nipple looks and feel when you touch them. So, in case you notice the following features, please visit the hospital. Number 1. Nipple tenderness, or a lump, or thickening near the breast, or underarm area. 2. A change in the skin texture or an enlargement of pores in the skin of the breast. Some describe this as similar to an orange peel's texture. And number 3. A lump in the breast. It's important to remember that all lumps should be investigated by a healthcare professional, but not all lumps are cancerous. When it comes to changes in your breast or nipple appearance, look out for any unexplained change in the size or shape of the breast, dimpling anywhere on the breast, unexplained swelling of the breast, especially if on one side only, unexplained shrinkage of the breast, especially if on one side only, and recent asymmetry, that is unequal or lack of sameness of the breasts. Although it is common for women to have one breast that is slightly larger than the other, if the onset of asymmetry is recent, it should be checked. Again, look out for nipple that is turned slightly inward or inverted, and skin of the breast, areola, or nipple that becomes scaly, red or swollen, or may have ridges or pitting, resembling the skin of an orange. It is also important to note that a milky discharge that is present when a woman is not breastfeeding should be checked by her doctor, although it is not linked with breast cancer. Let your doctor know about any nipple discharge, clear, bloody, or milky. The most concerning discharges are bloody or clear. Adult women of all ages are encouraged to perform breast self-exams at least once a month. For women still menstruating, a breast self-exam should be performed a few days after her period ends. And for those who are postmenopausal, a breast self-exam should be performed on the same day of each month, such as the 1st or 15th day of the month. You have to note that while mammograms can help you to detect cancer before you can feel a lump, breast self-exams help you to be familiar with how your breasts normally look and feel. Alert your healthcare professional if you notice any changes in your breasts, such as a new lump, sore spot, changes in the appearance of the skin, or nipple discharge. Self-breast examination can be done in the shower, in front of a mirror, and when lying down. So, let's delve into each of them. In the bathroom or shower, use the pads or flats of your 3 middle fingers. Check the entire breast and armpit area, pressing down with light, medium, and firm pressure. Check both breasts each month, feeling for any new lumps, thickenings, hardened knots, or any other breast changes. When standing in front of a mirror with your arms at your sides, visually inspect your breasts, looking for any changes in the contour or shape of the breasts, any dimpling, swelling, or other skin irregularities on or around the breasts, or any changes in the nipples. Next, rest your palms on your hips and press firmly to flex your chest muscles. Look for any dimpling, puckering, or other changes, particularly on one side. Note that the left and right breasts will not exactly match. Few women's breasts are perfectly symmetrical. When lying down, the breast tissue spreads out evenly along the chest wall. Place a pillow under your right shoulder and put your right arm behind your head. Using your left hand, move the pads of your 3 middle fingers around your right breast, covering the entire breast area and armpit. Use light, medium, and firm pressure to feel for any new lumps, thickenings, hardened knots, or any other breast changes. Also squeeze the nipple to check for discharge. Repeat these steps for your left breast. By performing monthly breast self-exams, you will be able to more easily identify any changes in your breasts. Be sure to talk to your healthcare professional if you notice anything unusual. To end this video, always remember breast screening can help find cancer at an early stage. And if any abnormality is detected early, it may be easier to treat. Because by the time symptoms appear, cancer may have begun to spread and may become more difficult to treat, increasing healthcare costs and shortening lifespan. Remember to take care of your health.